Hello and welcome to vertebral column thoracic rib cage with the sternum, the ribs, and all of the vertebrae. This is kind of a nice little reprieve. It's kind of a nice little relaxing little almost oasis in the skeletal system because these are actually pretty easy to understand. The vertebrae, I'm going to ask you in 3 different ways. So please try to pay attention to the 3 different ways I'm going to ask, just so you don't skip one. So knowing what does C1, C2 look like, how do you tell them apart, how do you tell cervical from thoracic and from lumbar, what does the sacrum and the coccyx look like, so all of your vertebral column, just can you tell them apart if you saw individual ones. That's pretty much, can you tell this one apart from this one? And hopefully by the end of the lecture, you will. Another thing is, I'm just going to talk about a bunch of the main structures. What is that structure right there? What are the ones on the sides? What are the ones in the back? And then what's that weird one that I'm putting my finger in right now? And then, do you know the parts of the sternum? Do you know what a rib looks like? So let's get started. Let's first look at the vertebral column. So your vertebral column is made up of cervical vertebrae, thoracic vertebrae, lumbar vertebrae, sacrum, and coccyx. You have a total of 32 vertebrae with intervertebral discs, and they're going to be made up of fibrocartilage. If you are taking the lecture along with this, you know fibrocartilage is what your discs are made up of, and you can see the discs are going to be the white, and it allows that shock absorption. So when you're jumping and when you're moving around and your spinal cord is bouncing from side to side, having that ability to absorb shock is very important, and fibrocartilage is what's giving you that shock absorption. Another thing, if you're doing the lecture class, you need to know that there's 7 cervical vertebrae, 12 thoracic, 5 lumbar, 5 sacrals that are all fused, and then 4 fused coccygeal. One important thing to think about it is up here in your neck, 7 vertebrae. You have 12 ribs, so you have 12 thoracic vertebrae, and thoracic are going to have these little facets that allow the ribs to attach to them. And then in your lower back, you're going to have your 5 lumbar. And the lumbar are always going to have very huge vertebral bodies because of all of the weight and all the stress they have to have from your upper body, and then the attachment to the lower body is just right there in your lumbar vertebrae. So let's kind of look at some other things not going to be asked about in your lab class, but you would have to know this for a lecture class. And here you can see the cervical, thoracic, lumbar, and pelvic curvatures. And the easiest way to think about it is if you're looking forward, and in this case she's looking forward, your first curvature is always going to go out. Or if you look at this shape that I'm making with the pointer, it almost looks like a C. So your cervical curvature is always going to go out, then it goes in, then it goes out, then it goes in. So that would be the correct curvatures of your spine. And then this. What do you need to know for all the different vertebrae? Vertebral arch, spinous transverse process, superior articular process, and facets. Let's look at this. So I take a lumbar vertebrae, and I'm going to start with where I'm pinching it right now. That's the vertebral body. The hole in front of it is your vertebral foramen. That's where your spinal cord is going through. Then you're going to have these little wings on the side. Those are transverse processes. And the one in the back is spinous process. And if you've ever kind of wondered, spinous process is in the back. Spinous process is what you feel when you feel your back. You feel the spinous process poking out. So spinous process is in the back, transverse processes are on the side, vertebral body, and vertebral foramen. You do have attachments and facets, which I mentioned. Don't need to really memorize them because they do change from cervical, thoracic, and lumbar. But what doesn't change is your lamina and pedicles. The lamina is between the spinous and the transverse process. So laminas are right there. It's just that strip of bone that connects the spinous and transverse processes. The pedicle connects the transverse process to the body. And you might think, why would I ever want to use that? If you ever have a bulging disc or a hernia in your spinal cord, you can see this part of the pulpus is coming through and it's pushing on those bundle of axons. Because it's pushing on it and it's blocking this one, it's usually going to be intense pain. You're going to have muscle weakness. You're not going to have feeling in parts of the skin because of this herniation right there. They give drugs, they do other surgical methods, but one of the last things they do a technique called a lamidectomy. And a lamidectomy is they cut through this lamina, and they remove the spinous process, which allows the spinal cord to move back and move away from this herniation right there. So a lamina and a pedicle are very important for other reasons other than just making you memorize them just because. The next group of questions, so that was, what are the general structures found on almost every single vertebrae? The next one, can you tell C1 apart from C2? C1 is the atlas. C2 is the axis. If you remember back to Greek and Roman mythology, Atlas is that titan or that large god before the Olympians came in Greek mythology that held up the world. That was his punishment. And in this case, the atlas right here holds up the skull. So on me, right below or right behind my skull, this is going to be what's holding up the skull. An atlas holding up the world. If you've ever seen those sculptures, this is holding up your skull. And you can tell because it has a very large vertebral foramen. Very large vertebral foramen makes it atlas. The next one is axis. Axis is important because it allows you to turn your head from side to side or give you an axis of rotation. And it does this by this little structure right here called the dens. So where my finger is right now, I am just spinning the dens from side to side. So not only do you have to memorize that this right here is the axis, you also need to know the structure, the dens, because it allows you to turn your head from side to side or give you an axis of rotation. So atlas is very important, an axis, and then the important structure on the axis is the dens. And this just shows you that dens has a ligament there that allows you to turn your head from side to side or give you rotation. Now, can you tell the three apart? Can you tell the difference between the cervical, thoracic, and lumbar? And there's an easy way to do it. Cervical vertebrae has 3 holes. So if I hold up any vertebrae that has 3 holes, look at it, 3 holes. 1, 2, 3, cervical. And you're like, wait, did the atlas and the axis have 3 holes? Yep. 1, 2, 3. Dens, 1, it's on the side, 2, 3 on the side. So every single cervical vertebrae are all going to have 3 holes. The way I would ask this on the test is, name this bone, and you would put cervical vertebrae. If I wanted you to do the atlas and the axis, name these bones, be specific. So this is specifically called the atlas. This is specifically called the axis. This one right here, thoracic. Thoracic is really difficult to do without the models. And the reason why I'm here in my office doing this is because these models, if you look at your thoracic vertebrae, they kind of look like little giraffes. And if you're like, wait, what was that little structure that's pointing down? That structure that's pointing down, or the nose of the giraffe, is your spinous process. And if you're ever looking in class or you see a full-size skeleton, or you have somebody, standing in front of you, you can see in where the ribs are, the spinous processes of your thoracic vertebrae are pointing down. And finally, lumbar. Lumbar is the easiest one because they have nice, thick, and stout vertebral foramen. Their spinous processes are pointing straight back. That's how you tell all three types of vertebrae apart, and that concludes all the different parts, all the different ways I can ask these questions. One thing I did leave out is, what does a sacrum and what does a coccyx look like? So if you're in the library, they get you a bone box. They give you all of these little things. You just kind of go through here almost like a grab bag and say, what's this? Lumbar. What's this one? Only one hole. Thoracic. How about this one? Three holes. Cervical. So if you can kind of answer those questions, then you have this slide down. If I pointed something like this and say, name this, vertebral body, vertebral foramen, spinous process, transverse process, lamina, pedicle. Name this one, be specific. Atlas, axis, and the thing I have in my finger is called the dens. So the other questions on here is, yeah, they have, 12, 7, and 5. That's great. Still have the sacrum and the coccyx. So I could show you the model of the sacrum and the coccyx. They're always going to be fused together. We're not going to go into the lines and the other foramen and holes. All you're going to do for my class is, can you identify the sacrum and can you identify the coccyx or tailbone? Next model we're going to go over is your thoracic cage, or your sternum. Your sternum only has three parts: manubrium, body, xiphoid process. Manubrium is up top. This is where the clavicle attaches to. Body is in the middle. Xiphoid process is at the end. And if you've ever done CPR, and you've taken CPR classes in high school or middle school, or if you're a lifeguard or EMT, paramedic, or firefighter, or a nurse, any of these things, you're going to know that the xiphoid process is right there. That is why when you're doing chest compressions, you're always going to follow up to the rib cage, take your two fingers, and make sure you're doing chest compressions with the palm of your hand right on the vertebral body. Because if you go down here with the xiphoid process, you can see it's this is only plastic, but this is pretty sharp. And the xiphoid process can break off and actually puncture a lung. So not only is the heart not beating, they now have a punctured lung, so they have a lot more problems, and it will be a lot more difficult for them to recover from that type of injuries. And then the top, manubrium. So again, this is what? Manubrium, body, xiphoid process. And then the last but not least, can you identify a rib? The rib does have one end that has a bunch of bumps, one end that is smooth. It is kind of important to know the different parts, because if you're in the library and you're putting these all together, the ones with all the different parts of all the bumps, that's what's going to be connecting to your thoracic vertebrae. And you can see, if you just kind of looked at the two, all of those little bumps are going to fit into all of those little facets for the thoracic vertebrae, and that smooth part is all going to be attached to these cartilages on the sternum. So the shaft, the groove, the angle, the neck, all the different facets and everything else won't be asked on your midterm, but just identification of a rib could be asked on your midterm. And like I said, this was a nice little oasis and a nice little getaway from the skull and the appendicular skeleton, which is coming up next. So hopefully you understood everything. hopefully those little pauses allowed you to answer the questions. And good luck studying on the skeleton.